May is Mental Health Awareness Month, and today we're talking about the importance of discussing the topic of mental health with children. Governor Gavin Newsom issued a proclamation declaring May 1st through 7th as Children's Mental Health Awareness Week. And joining me now is Dr. Jennifer Zumarraga, a child and adolescent psychologist at Camino Health. Thank you so much for being here.
It's great to be here. Thank you so much for having me.
Of course, we have a lot to talk about. This is such an important topic, and I'm sure you are glad to be able to focus on this. You're holding an upcoming free event focused on kids and mental health. We'll get to that in a moment. But first, we've seen studies about 3 in 5 U.S. teen girls feeling sad and hopeless, and other similar studies when it comes to boys, too. Can you talk about some of the newer challenges that you're seeing when it comes to kids and mental health?
Definitely. We definitely saw an uptick in depression, sadness after the pandemic. It was also occurring before, but there was more of an isolation when the pandemic took place. And coming out of the pandemic, we also saw a lot of anxiety returning back to schools. So we're seeing a lot of that. And yes, the CDC, they came out with their information, and it is really a crisis that we are going through in this country.
I was listening to an interview the other day saying that in addition to the pandemic and what the kids had to go through, social media is playing a role. Can you talk about that? Are you seeing that as well? Is that impacting their mental health?
Absolutely. I see that very often. We get kids that are spending hours upon hours a day on their social media and their devices and video games, and it really is impacting them. Oftentimes, there are kids that are comparing themselves with other kids that are very unrealistic. We also see that when kids are taking so much time on social media, then all of the other activities decrease. So sleeping decreases, eating decreases, socialization in person, exercise, all of those things are, they're all decreasing. And so not only the direct impact of what they're seeing on social media, we see that, but we also see all the other things that are affected.
But some people say, and kids will say, but that's how we interact. That's how we socialize. We do it through our phones, through the apps now. Is it just about finding a good balance of how long they're on social media? What do you say to a teen that says, this is how we communicate?
Yes, definitely. And I think there are so many good things about social media. And I think that, they're communicating and they have a great way to connect with people when the distance is too far. But I do think that they can have too much of a good thing. And when it's interfering with other things that they need to do, like school and like I said, sleep and nutrition and exercise, then that's when we see it becoming a problem.
And kids that are as young as 5 years old are also, studies that have come out that they're feeling stress, anxiety. Can you talk about that real quick, and then maybe give us some advice about talking to kids that young?
Yes, I am seeing that in talking to some of the parents, and I work primarily with teenagers, but they have younger siblings. And so the stress within the family system is really palpable from the children as well. So when parents are more stressed and their older siblings are more stressed, then it trickles down to the little ones. So we're definitely seeing that.
And you have something out there that's going to hopefully help some people, some parents, some kids, the Aspire program. Can you quickly talk about the program and your virtual free event that you have coming up and what that's going to entail?
Yes. Well, so the Aspire program it's an intensive outpatient program. It's about 8 to 10 weeks, and we have different programs for different ages. So there's a middle school program, a high school program, and a transitional age program, which is from 18 to 25. We also have a program that's for kids with addiction. So high school students with addictions, that could be either substances or alcohol, and then also with screens. So that's our newest program, and we definitely get a lot of questions about that. We're there in the programs to teach different skills that they can use lifelong to help them to be able to deal with the stressors that we all come in contact with in our lives. So we do talk about distress tolerance and interpersonal effectiveness and mindfulness, and then also emotional regulation. Those are the big things that we focus on and teach them skills, and then they practice.
And
That's why it's
right now we did just have some information up on our screen about that event, so people can sign up. It's free, it's virtual, and parents and kids can learn a little bit more there. Dr. Jennifer Zumarraga, thank you so much for your time today on this first day of Mental Health Awareness Month.
You're so welcome. Thank you so much.
Of course.